Hello, Professor Bronin. This is Robin Keller, and here's my video for the Aging and Disability assignment. The definition of old is having lived for a long time or no longer young. The meaning of getting older is being less active, having less hair, taking more medication, more wrinkles, arthritis, becoming forgetful, and potential lack of independence. The definition of disability is a physical or mental condition that limits a person's movements, senses, or activities. A physical or mental handicap, especially one that hinders or prevents a person from performing tasks of daily living, carrying out work, or household responsibilities. How might the understanding differ generationally and culturally of both of those definitions? I'm sure vastly. If you ask someone who is 40 or 50 years old what is old, they might probably tell you someone 80, 85. I'm sure that's relative to how old they feel themselves. I mean, if they're a 50-year-old who's healthy, their definition of what's old is not the same as a 50-year-old who's maybe not as healthy or suffering some disease process. They might feel old already at 50. If you ask someone who's 18 or 20 what's old, they're going to probably tell you someone who's 40 or 45 is old. Kind of that statement that age is relative. How does the understanding culturally differ? People in Japan value their people of age much more than we do here in the US for their knowledge and their experience. If a family needed care for being old, I hate that word, being old, it sounds very derogatory to me, or a disability, who would provide it? What does family mean? My definition of family is probably different than the average person's. I grew up in a neighborhood where everybody knew everybody, and all my neighbors were my family. Sometimes they were at the Thanksgiving table with us. Oftentimes they were at the Thanksgiving table with us. So I have aunts and uncles. I have tons of cousins. I probably have 15 cousins. I can't even count them. And we all at different times have done lots of things, stepped in for my grandfather to take care of him. He's 94. We lost my grandmother several years ago, but pretty big, strong family structure. And the neighbors, have earned those nicknames, Aunt so-and-so, Uncle so-and-so. So the definition of family for us is there's people that are there with you. They stick with you through thick and thin, and they're always there. And we are the people that take care of each other. Like my grandfather who's 94, we have a neighbor that will come and sit with him, and he does a great job if my grandfather has to get to the restroom and for whatever reason can't, and needs extra help, maybe cleaning up afterwards, whatever. So we definitely have that support system going on. As far as who provides the care for a disability, that's me. You're looking at her. Me, my mom, my daughter, my son have all stepped in to extensively care for disabled people in our family. My father passed away several years ago, but he was very brittle diabetic for the last 3-4 years of his life. He needed a substantial amount of care at home. We had a nurse that would come every couple of days, but we did all the Foley care and all the medication administration, monitoring blood sugars, etc. So that was us. And the other way that I have provided a ton of disability care is my ex-husband. We were married for 20 years. Now he's retired firefighter paramedic, but he had several unrelated injuries to his spine in the line of work, and that forced his early medical retirement from the fire department. I should tell you though that through that disability, through those injuries, the doctors would only treat him with pain medications. So there was a secondary disability, an addiction to those pain medications. And those two worked together and created some awful spirals in life, and did play a role in us no longer being married. So, yeah. How has disability impacted my life? Well, kind of just told you all that. My father passed away. He was lucky enough to get to pass away at home. My mother was there with him. So a little bit sad, but that's how they wanted it. So I am thankful for that their wishes could be how it happened. Disability impacted my life. My ex-husband and I are divorced. That's not the only reason, but it played a large part of it. It played a large role in that. Some statistics and attitudes towards disabled or people of age. First of all, I don't like to say old people because it's so relative, and to me it has sort of a derogatory connotation. So people of age, I kind of go with that. You're as old as you want to be. You can be 21 and act like you're 95. So I like a people first language. I like using words that reference the person and their abilities and not their disability, and not, whatever. Especially because I take care of a lot of older people. If I'm working in the main hospital, I also work in a NICU. And I have to remember that those people ran their own finances. Some of them were business owners. Some of them, doctors and lawyers themselves. And some, ran households and were in charge of families and budgets and things like that. And so I always treat them with respect, and I always, no matter how much their age has robbed them of their physical ability or has challenged their mentation, I always speak to them as though they are whole, and as though they do make those decisions. I don't ever use the words honey, baby, sweetheart, dear. Nope, not at all with my patients. I feel like that's really derogatory. People first, Mr., Mrs., especially the first time I'm meeting someone. Mr. Johnson, my name's Robin, I'm a respiratory therapist. How would you like me to address you? If Mr. Johnson seems as though it makes him uncomfortable. Otherwise, it'll be Mr., Mrs., ma'am, sir, etc. When I speak to a person with a disability, if I have a question about the disability, I will ask if it's relative to what we need to accomplish in that moment. Otherwise, it's not my business. It's not something I'm sure they want to talk about or have it be like as plain as the nose on their face, so to speak. If the person with a disability happens to be in a wheelchair, I like to back up just a little bit. I don't like someone being in my space. And if they're in a wheelchair and I'm standing over them, I'm kind of in their space, and I'm also making them strain to see me. So, and I find with a lot of my patients, sometimes getting a little bit below their eye level it's a nonverbal way to communicate that I'm listening and that I am there to listen. So I do like to do that. For people with, oh my gosh, I lost my word. For people, for non-hearing persons, excuse me. I don't like the word deaf either. Excuse me. I feel like it insinuates something. And really the problem is they just don't hear. It's too easy for people to infer a lack of mental capacity when we say deaf. Don't shout at deaf people. Most people in general have some ability to read lips, and deaf people certainly have the ability to read lips to a greater extent if they don't communicate via sign language. They have some ability greater than ours normally to read lips. They also are very good at taking into context their setting. Am I in a bank? Am I in a grocery store? Am I in a hospital? And what might that person be trying to communicate to me given the setting that we're in? So if you are to shout at a non-hearing person, it's very, very insulting. It's also very insulting when you're speaking to a non-hearing person to turn away where they can't see your lips. Even if they're not a lip reader. It's hard for them to get those nonverbal cues that you're communicating with them, and it's harder for them to understand what you're saying. Again, I would always just ask somebody who I think by looking at them has a disability, I would ask. If it's someone who approaches me in the hallway and says, where are the vending machines? And they look like they maybe can't walk that far, and I know the vending machines are further away, I'm going to keep that top of mind. How could we as a society do better in addressing the needs of our aging population or our disabled population? We could do a ton better. The disabled population has an absolute awful uphill battle legally just in establishing themselves as a person with a disability. That process is phenomenally hard and extremely costly. So legally, we could do it. We need to change our laws about how a person would become declared disabled and etc. It's just a horrible process. It's really hard. Our people of age could use a lot more protections. They get solicited on the phone, they get solicited over social media, they get solicited in so many ways, and some of them do not have the support of their families or other people to help them understand, no, you don't need this vitamin for that. No, you don't have to spend this kind of money. Yes, your mortgage is okay, etc., things like that. People with disabilities have a much more difficult time gaining employment and keeping employment. Their employment rate is in the neighborhoods of 50% as compared to non-disabled persons. People with disabilities suffer a more severe loss in participation in the labor force when there's an economic downturn. They have a harder time obtaining employment because of healthcare costs. Persons with disabilities, as you can imagine, have a higher healthcare costs. They have mobility issues. Their employers are worried about, are they going to call off and not be here, call in sick more often than a person without a disability. So age and disability somewhat go together and somewhat do not. They are a specific challenge. Age, not as much, but disability is a huge reason we have a homeless population. It's, as I said earlier, it's not very easy to find legal protections if you're disabled. It's very difficult to find employment. And without both of those things, you wouldn't have health care and you wouldn't probably have a place to live. And if you don't have a very strong family structure and some, people in your life that are willing to step in and allow you to live with them or help you with your health care, etc., that's why we have a homeless population. It's very sad. So this was one assignment that I feel like I had a lot to offer and knew a bunch about. So I appreciate the opportunity. Thank you.